Inequality in Healthcare Among Black Women by Mackenzie Chapman and Ashley Flittis. Black people feel less pain. Dr. Thomas Hamilton, founder of Myth, had an obsession with proving the differences between white people and Black people, psychologically and physically. Hamilton performed excruciatingly painful medical experiments to prove Black people feel less pain than white people. His reason? Black people have thicker skin and less sensitive nerves. These fallacies were legitimized in medical journals and encouraged racial disparities.
Father of gynecology, James Marion Sims. He performed experiments on slaves without anesthesia. His reason was due to the misguided beliefs that Black people didn't experience as much pain as white people did. Experiments conducted were Sims speculum, Sims sigmoid catheter, and Sims position. Anarcha, 17-year-old enslaved woman, had a very traumatic labor and delivery. Sims' fistula surgeries were not successful. After 30 operations, he finally perfected his method after 4 years of experimentation on her. Then he began to practice on white women using anesthesia.
Maternal mortality rates. In the United States in 2021, the maternal mortality rate refers to the number of women who die from pregnancy-related complications per 100,000 live births. The maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 100,000 live births, which is 2.6 times higher than the rate for non-Hispanic white women, which was 26.6 deaths per 100,000 live births. This means that Black women were significantly more likely to die from pregnancy-related complications than white women. The maternal mortality rate for Black women was significantly higher than the rates for both white and Hispanic women. Additionally, there has been an increase in maternal mortality rates for all races and Hispanic origin groups from 2020 to 2021, and that these increases were significant.
So here is a data chart of the facts and data presented in the last slide. Statistics. According to an article by Tulane University, Black mothers are at least 3 times more likely than white mothers to die in childbirth. Black Americans have the highest rate of post-traumatic stress disorder, PTSD, of all races. Black Americans are more likely to die prematurely from all of these types of diseases. Blacks are more likely than whites to suffer from cancer, diabetes, and heart disease. Black women experience early deaths due to racism and sexism from the effects of economic, environmental, and interpersonal stressors. These high mortality rates and psychological rates show that systematically our healthcare wears on Black individuals, thus resulting in declining health. Racism is indeed a public health issue.
Example 1. In the 2021 article titled Trying to Avoid Racist Healthcare, Black Women Seek Out Black Obstetricians, Hibbert describes a personal testimony describing her experience while she was pregnant with her first child. During her first pregnancy, Danielle Hibbert had a white obstetrician at a suburban hospital outside Miami, which did not feel welcoming to her as a Black woman. Hibbert felt a lack of understanding of her cultural background, including the food she eats and her upbringing, as evidenced by the hospital's lack of photos depicting Black women and their children.
Example 2. People of color encounter obstacles beyond health insurance that impedes on their access to health care, such as restricted entry to hospitals and medical professionals, and the unavailability of cultural and linguistically sensitive care. These obstacles may be more evident in remote and medically underserved regions. Recent studies suggest that the increased shutdown of hospitals and obstetric units in rural areas has a more significant effect on communities with a larger Black patient population.
Example 3. In Brooklyn, there is a significant disparity in pregnancy and delivery related deaths between Black and white women, with Black women being 8 times more likely to die from these conditions. This crisis prompted New York Mayor Bill de Blasio to launch a $12.8 million 4-point plan in July of 2018. The plan aims to provide implicit bias training for both public and private healthcare providers, improve data tracking and analysis to better prevent maternal mortality and morbidity rates, enhance maternal health care at city hospitals and other healthcare facilities, and establish a partnership with community-based organizations to raise public awareness of maternal health issues.
The case of Kara Johnson. Kara, a beautiful mother and wife, died shortly after giving birth to her second son after receiving inadequate care from Cedars-Sinai Medical Center for a second time. The Johnson family received inferior care because of the color of her skin. After another judge tossed these allegations earlier this year, an autopsy showed that she died from internal bleeding following a planned C-section in April 2016. According to a release from Johnson's attorney, the lawsuit alleges the length of surgery, which was 17 minutes, and reckless. Less than 2 hours after Kira's surgery, her husband noticed blood in her catheter bag. Over an hour later, a surgical emergency CT scan was ordered for Kara. However, the scan never happened, and she wasn't taken back to the operating room to find the source of bleeding until well after midnight, despite her husband's pleas for help. By then, it was too late to save her. Kara Johnson died of a postpartum hemorrhage, leaving behind a family due to the negligence of Cedars-Sinai Medical Center.
The case of April Valentine. April Valentine anticipated the birth of her daughter, Anaya, with her boyfriend, Nidra Robertson. Valentine was going to get a C-section at Silentina Hospital Medical Center in Inglewood, California, on January 9th, 2023. However, that same hospital was under investigation after Valentine passed away the following day amid allegations of neglect. After the surgery, April was complaining of leg pain. However, her nurses advised her pain was normal. Her loved ones claimed the hospital continuously ignored the patient's complaints of pain, neglecting her as Robertson performed CPR on her. April's story is yet another example of negligence Black women face.
Importance of equal health care. Every person deserves to live a happy and healthy life. Due to social, economic, and environmental factors, not everyone has access to proper health care. The statistics and experiments recorded of Black healthcare has shown racial inequities from room to tomb.
Social Action Plan. Brittany D. Chambers, amongst other female healthcare workers of diverse backgrounds, conducted a research study to investigate the attitudes of healthcare providers towards the impact of racism on Black women's pregnancy experiences, perinatal care, and childbirth outcomes. With the results of the research study, they proposed a structure reform. They explained that it is necessary to establish policies and protocols that ensure healthcare providers are held responsible for delivering fair and courteous treatment to Black women, children, and families. To improve the quality of care provided to patients, clinicians should be required to take continuing educational courses that address implicit bias and mistreatment. Additionally, legislation such as SB 464 which focuses on improving pregnancy-related care for Black women, is crucial. In order to develop training that respond to the needs of healthcare providers, it is important to engage in discussions with them to gain an understanding of how racism operates in healthcare settings from their perspective.
Social Action Plan continued. Black patients report that many healthcare providers still exhibit dismissive, condescending, or impatient behavior, which only worsens the issue of mistrust. As a result, some Black patients express a preference for receiving care from Black physicians, but often face challenges finding them. Along with shared culture and values, a Black doctor can provide Black patients with a feeling of security, affirmation, and trust. Studies reveal that racism, discrimination, and unconscious bias persist in the American healthcare system, leading to an unequal treatment of racial, and ethnic minority groups. Another social action plan that has been put into place is the website Black Doctors of Florida. The link is presented right there. In Southern Florida, individuals who seek Black doctors often reach out to Adrian Hibbert through this website.
Here are references